Okay, Kim. I thought it might be a good idea to just reflect on that teaching session that we did earlier on today about getting the intramuscular injection. Are you happy to go over that teaching session now and work through some feedback?
Yep, that'd be good.
Great. Okay, I've just made some notes here about what I was thinking about the session, but I'll just recap. So what we did is we did a teaching session run through in the simulation lab in the last week, and then this morning you did an intramuscular injection on the ward with Joe. You injected the patient Joe. So how do you think that went generally? How do you think the teaching session and getting the intramuscular injection went?
Yeah, in real life it was a bit more nerve-wracking. I'm glad I did the simulation, but yeah, I don't know if I did that well in real life.
Yeah, no, it is always, doing it simulated is always different to doing it on the patient. I think it might be good for you to tell me then what you think you did well during that session and why you think you did that well.
Yeah, I thought I did identification checks well. I remembered those and looked at the meds chart and what I was actually administering and gained informed consent. So yeah, I thought that went well. Yeah, it was good.
Yeah, I would agree with you. You did a really good job of checking off the right patient, the right medication, checking the right route. And you also checked for allergies, and you did check for informed consent. You did that without any prompting, so that was something that came from, and we hadn't really done a lot of that in the simulation lab. We were mainly just focusing on the technical side of things. So that was really good because you just worked with that. You managed that situation really well, or that part of the interaction really well. I also think that your technical skill was really good. You drew up the medications, no problem. You had everything you needed. You were really well prepared as well also. So when you were getting the drug ready, you put that down, you put the needle and syringe down after you drew up the drug, and then you prepared the cotton wool with the tape ready for after giving the injection. So you were thinking the process the whole way through and you were preparing from start to finish. Your technical skill was really good. We practiced the Z tracking in simulation and we talked through it again in front of the patient. But you did that technical skill was done really well. And essentially that's what we were there to do. We were there to do an intramuscular injection and you carried out that task really well. So if you had to time again, or next time when you go to do a similar type of procedure or skill, what would you do differently?
Well, I think, yeah, being nervous, I perhaps just didn't talk as much as what I thought I normally would and just have that bedside manner. So I think I was concentrating more on actually doing it and doing it well, and maybe I disregarded the patient a bit. Yeah,
I think, again, I would agree with you on that one. So in my notes I had said, it would be next time, so one of the things that you could have done better in that particular interaction was introduce yourself to the patient. So I guess you could make that part of your informed consent because you're identifying who you are to the patient. So, hello Joe, my name's Kim Jansen, I'm a third year midwifery student from Flinders University. So straight away they know where you're coming from and that you're being supervised and what your level might be at. They get some idea about who's about to do the procedure on them. So I think in any interaction as a student and as a fully fledged clinician, it's always good to kind of say, hi, Joe, I'm Dr. So-and-so, or I'm a midwife. And so just that initial interaction. And then, you were really focused on doing the skill. And again, like I have to say, that's what we were there to do. But so my sort of what I would sort of choose for you to do differently next time, and it will probably be a layered effect. So this time you did the procedure and you did that really well. Next time you can think about adding on sort of more of the patient interaction. So yeah, I would say that introduction and more communication and interacting with the patient. But aside from that, I think that, like I said, the technical skill was done really well. You were really good at remembering your universal precautions. So, you know, you made sure that you washed your hands first, you put on your gloves, you were really safe with your use of equipment. So you kept yourself safe and your patient safe. But the communication is something that we can work on. So what would you suggest that in terms of sort of taking that feedback and then feeding it into your next interaction, we could think about some learning goals from the teaching session this morning. Do you have any suggestions? I mean, you've already mentioned that the communication was an issue. Would that be one of your learning goals?
Yeah, I think, I guess just, thinking of bigger picture stuff and add that into my normal procedure, make that an objective.
Yeah. So one of the ways that we can do that is do some more work in the simulation lab using standardised patients, so people who actually talk to you as opposed to a mannequin. So we can organise you to be involved in some scenarios that specifically focus on communication, patient interaction. Another thing that we could also do to achieve that learning goal is just, sometimes I do it as well, just rehearse what procedure I'm about to do and then anticipate what the communication might sound like, and then also anticipate any questions or interactions that might come from the patient and how you might answer those. So basically preempting the situation and the communication around that. So yeah, that's what we'll do. We'll go away and we can formalise it and maybe make a bit of a learning plan. We'll use a simulation lab, we'll use standardised patients and maybe some rehearsing of patient interaction for future times. So does that sound okay with him?
No, that would be good. I think that will just benefit me and my practice.
Yeah, great, okay. You did a great job and it was really good working with you this morning, and thank you for giving me the opportunity to give you some feedback. And yeah, I look forward to working with you in the future. Thanks, Jim.